So regenerative medicine has this phenomenal capacity and potential because what it's doing, it's leveraging your body's own repair mechanism. So this is something that we're using every day. So for everyday wear and tear, let's say that you're out there and you're exposed to certain environmental toxins, you're breathing certain things. So your body has to repair the damage that you're doing to these things, right? So what we're doing with regenerative medicine is we're basically leveraging that same repair mechanism that our body has. We either harvest stem cells from the same patient or we get them from a cord blood donor, and we use those naive and ready to use cells in order to trigger our own body's repair mechanism. And that is radically different to what we've come to expect from a healthcare, from a medical approach, where it's always trying to fix something, whether it's a pharmaceutical approach or even a surgical approach. This is leveraging our body's own repair mechanism. Well, like I was saying, if we're using our body's own repair mechanism, there's a lot of different conditions that can benefit from stem cell therapy. Now, what's most important is understanding what the current limitations of regenerative medicine in general are. People tend to fall, especially nowadays, they tend to fall within two ends of a spectrum. Either they believe that this is miraculous and can cure everything, or they believe that this is a complete scam and that people are just being ripped off. And in reality, the truth is more it's in the middle of it. It's closer to the center, because what happens is that we can certainly improve and we can certainly repair at a tisular, at a cellular level, and we can reverse some of the damage that has been caused by certain conditions. But a lot of the times we will still need to address the underlying reason why we develop that damage. So for instance, if we have, let's say, orthopedic damage and you fall down and you break an ankle and you have an unhealing fracture, you use regenerative medicine to heal, then that's it, and you're done. But if you have an autoimmune disorder that is constantly affecting you, or let's say you have multiple sclerosis, then what's going to happen is that whatever improvement that you reach, you will continue to progress. So that condition, you're not curing anything. You are reversing part of the damage. You're helping your body heal itself, but you're not getting rid of the original diagnosis, which is something that us as clinicians need to fully understand, but most importantly, we need to transmit better to our patients so that they know what we're trying to achieve with the therapies. When regenerative medicine, and I've been in the field for the last 10 years, and what was originally thought of is that whenever you utilized exogenous stem cells, whether they were autologous or allogeneic, so from a donor or your own, what would happen is that they would go into your body and find a damaged tissue and then become that tissue and differentiate. And while that is definitely one of the characteristics of a stem cell, it is not something that happens in vivo. So when a patient receives it, that is not what those stem cells do. However, what they do is that they release a lot of different cytokines and signaling factors, and they start recruiting your own endogenous cells. So if for instance, I get somebody else's, an umbilical cord donor cell, and I receive them in my body, what that's going to do is those cells are going to release a whole host of anti and pro-inflammatory cytokines that are going to be recruiting different kinds of cells, and that are also going to promote my own stem cells to start going out there and repairing all these different damaged tissues. And that's what we call a paracrine effect, because they're releasing all these signalers and they're recruiting other cells. And that is really where the effect of stem cell therapy falls.